Channel 3. Breaking news this morning from the FDA. There's a serious side effect occurring when amiodarone and hepatitis C medications are used together. Amiodarone is a Class 3 antiarrhythmic medication and is classified by the Vaughan-Williams classification system. It is also its prototype. You may know amiodarone by its brand names Porterone, Nextrone, and Pacerone. Amiodarone is used to treat various types of arrhythmias, also known as irregular heartbeats. To understand more about this medication and its mechanism of action, Priska Taylor has our story.
Thanks, Shelby. As a Class 3 drug, amiodarone will bind and block potassium channels responsible for Phase 3 repolarization. This results in an increased duration of the cardiac potential. However, amiodarone does not stop there. It actually has properties of all four Vaughan-Williams classifications. Like Class 1 drugs, amiodarone blocks sodium channels responsible for Phase 0 depolarization. This results in a decrease in the conduction velocity of the action potential. Like Class 2 drugs, amiodarone non-competitively blocks alpha and beta receptors of the heart. Inhibition of sympathetic stimulation results in a decrease in the heart rate and decreased contractility of the heart. And finally, like Class 4 drugs, amiodarone blocks calcium channels, resulting in vasodilation and a decreased heart rate. And now, Lauren's going to talk to you about kinetics and metabolism.
Thanks, Priska. Amiodarone is a drug that can be administered both intravenously and orally. In an outpatient setting, oral administration is used. It is best to take amiodarone with food to decrease the GI effects that may occur as a result. However, if you do choose to take with food, be sure to avoid any grapefruit juice because this can affect the metabolism of the drug. Amiodarone also increases the amount of iodine in your system. Therefore, iodine intake should be limited to 150 micrograms per day. Amiodarone is a prodrug that is metabolized hepatically by CYP2C8 enzymes into an active metabolite known as N-desethylamiodarone. Amiodarone is eliminated predominantly in the feces, with only 1% of drug being eliminated unchanged in the urine. The onset of action for amiodarone could take anywhere from 2 days to 3 weeks, with a peak effect being seen between 1 week and 5 months. Clinical effects of amiodarone are seen within 6 weeks of use. Now I'm going to send it over to Jackie Brown, who's going to tell you more about adverse effects.
Thanks, Lauren. Now we've heard about some of the good things amiodarone can do for our bodies. I'm here with a little bit of the bad news as far as the adverse effects are concerned. Some of the more common adverse effects we see with this drug include cardiovascular things such as hypotension and bradycardia, CNS effects that include dizziness, malaise, or fatigue. We also have patients that experience tremors on this drug. Some GI effects include nausea, vomiting, and constipation, and corneal deposits are the most common side effect of this drug. Some of the more concerning adverse effects with this drug include the corneal deposits that begin to affect vision, pulmonary fibrosis, and hyperthyroidism or hypothyroidism. Now we'll go back to the newsroom for a little bit of patient education.
Thanks, Jackie. And here we've called on our pharmacy experts to walk you through a patient education consultation.
Hi, how are you today?
I'm good, how are you?
I'm good. What can I do for you today?
I'm here to pick up some medication my doctor sent over.
Okay, do you know what it's for?
He said it's for the flutter in my heart.
Okay, great. We have some amiodarone for you today, and it's absolutely for that. It'll be for the flutter. Now, did your doctor tell you how to take this medication?
No, he said you all would tell me about that.
Okay, great. Well, you can see here on the directions, it's actually a stepwise dosing, and you're going to take this by mouth. Now, when you take this medication, you can take it with or you can take it without food. Now, tomorrow when you take the medication, if you decide to take it with food, you want to make sure that every single day from then on you take it with food. If you decide to take it without food, you want to make sure from every single day from then on to take it without food. And then, did he tell you what to kind of expect with this medication when you take it?
No, he really didn't say much about it.
Okay, well you may experience some things like nausea, vomiting, and constipation. You may also feel your heartbeat kind of being slower and some tremors. Now if you experience those, you definitely want to call your doctor and let him know. And the major thing is some changes in your vision. If you do experience changes in your vision, definitely let your doctor know. Are you allergic to anything?
No, not that I know of.
Okay, great. So this does have an iodine interaction, so if you're allergic to iodine, we definitely want to know about that. And then as far as grapefruit juice, do you like to drink grapefruit juice in the morning?
No, it's gross.
Okay, that's good too because this one does interact with grapefruit juice. So that's great that you don't like to drink the grapefruit juice. Now, what questions do you have for me?
I don't have any questions. I think you covered everything.
Okay, great. Well, whenever you store this, you want to make sure to store it in a dry place and protect it from light and away from humidity, so don't put it like in your bathroom or anything like that.
Okay.
So if you have any questions, please feel free to call us. It was great seeing you today.
All right. Thank you so much.
Thank you. Have a great day.
You too. Thanks.